I mean, do you want to test my blood pressure one more time before we decide? I don't think it's probably going to change much, but...
So Eric came to see me today. He has a humongous lipoma on the back of his neck. It is interfering with his hairline, and most importantly, it's interfering with his life.
Oh wow, it's like a melon. Biggest I've ever seen.
It's time for Eric's surgery, and Eric is having a very serious freak out moment. His blood pressure is through the roof.
Probably even higher now than it was.
It's 196 over 114. My plan is to apply local anesthesia, but that can also increase your blood pressure. And if his blood pressure increases even more, it could cause internal bleeding. It could cause him to have a stroke or a heart attack.
It's never been this high before, ever. But I mean, this is also extremely unusual circumstances.
Right, it's stressful. It's very clear to me that Eric has a white coat syndrome, which basically means you don't trust doctors, or you have anxiety or fear about doctors. And I think that is causing his blood pressure to increase. Your anxiety is causing you to have such high blood pressure. If you want to take Valium, we'll give you Valium.
Okay.
We're gonna offer Eric a little bit of Valium to help reduce his anxiety. And if that brings down his blood pressure to a comfortable level that I'm okay with, we will probably proceed. If we can't bring down his blood pressure even with that, then we're gonna have to abort.
I guess I need to think about it.
If you wanna call somebody?
Yeah, I was gonna call my mom.
Yeah.
And talk to her.
Call your mom. We'll be here.
You know, feeling, really anxious leading up to the last couple of hours. So, I don't know what to do. I mean, I want to have it done, obviously. I want to get it over with and be done with it, but it needs to be in a safe manner. Safety's first. I have people counting on me at home. I have a young daughter that counts on me exclusively. So, things have to be done right.
Hello.
Mom, so I'm here. And my blood pressure is too high, so they can't do anything right now. Now, what they can do is they can give me sedatives, and she thinks that it may just be anxiety, but just listen to me. They're giving me a few minutes, all right? Mom, okay, all right, just listen to me and help me, okay? I mean, I'm fucking going crazy. I mean, Jesus Christ.
For me, my goal is for you to be happy and have this lipoma removed.
I mean, let's go ahead and try it, I guess, and let's see what happens if my blood pressure comes down enough.
Okay, that sounds good, like a good plan. If we can't bring down his blood pressure even with Valium, then we're gonna have to abort. This is 5 milligrams.
Right. I don't think it's gonna be enough to affect my blood pressure.
Okay.
But we'll try it.
We'll try. And then we'll just let you sit here for about 30 minutes or so.
Okay.
I understand that Eric is very anxious and fearful, worried about the surgery. But I know that this will be life-changing for him, especially as a single dad and having a daughter who looks up to him and who is very present in her life. This is gonna change their world. Hey, Eric, we're gonna go ahead and recheck your blood pressure.
Okay.
All right, go ahead and sit in.
So it's 165 over 103. Eric's blood pressure did go down after taking the medication, but it's still too high for us to proceed today.
So it's just not working. Yes, I am disappointed. I would be lying if I didn't say I'm not a little bit relieved that, I know I'm going to be safe for today, and if we had had surgery, it may not have gone well.
One other option is if you did undergo general anesthesia, it would be probably beneficial for your anxiety. Unfortunately, we don't do general anesthesia in our clinic, but I do have a plastic surgeon in the building that we know.
That might be what we need to do. I don't want to say for sure that's what we should do, but that does sound like a safer option to me, maybe. Even though general anesthesia offers a whole nother host of potential complications, in my case, with my blood pressure and anxiety, it may be the right choice. But these are just options. Nothing has been decided yet. I'm still a little bit, just worried about the surgery in general.
You ready for me?
Yes.
Okay. My patient, Isha, she's really suffering. She has boils and
oozing and painful cysts underneath her armpits, her breasts, and her groin. It's really uncomfortable, so I'm really hoping that we can take care of her. All right, let's take a look. So you have some active lesions here. Oh, you have a lot of
Scar tissue.
Ooh, yeah. When I examine Nisha, I see really extensive scarring, in particular in her armpits. Those are areas where she had previous infections, previous inflammation, and now it's all scarred over.
Can I get some hair?
Absolutely not.
No?
No, I'll tell you why. The problem that you have is a problem with the hair follicles.
Oh, so we don't want to bring
No, one of the ways we treat this or help treat it is to get rid of the hair. This is a hair disorder called hidradenitis suppurativa, where the hair follicles and the oil glands get clogged and you get infection, tenderness, pain, bad scarring. So it's an awful condition and it can be really debilitating. One of the things that make it worse is having hair there. Okay, can we talk about what the plan will be for you?
I came into the appointment excited to learn about ways to grow hair in those areas. But then when Dr. Mina explained the reasons why I shouldn't have hair in those areas, I felt disappointed. But then I understood where she was coming from.
So I definitely feel that you have the diagnosis hidradenitis suppurativa. Individuals with hidradenitis have really high levels of inflammation, scars, sinus tunnels, draining, open skin, wounds. You do tend to have it more in the folds. So right along here, underneath the breast, and then the pubic area. It can affect personal relationships.
It does.
We're gonna try to help, okay? So I wanna start you on a medication to decrease inflammation. I'm also gonna have you just wash with an antiseptic wash because these things can get infected. And then when you have a bump, I'm gonna have you apply a topical antibiotic to that area.
Okay.
Now let's talk about the surgical aspect. One thing I'm gonna do for you today is this de-roofing technique. With hidradenitis, you have these tracts that just hold inflammation, debris, infection, and eventually it all scars over and it tunnels underneath the skin. So the de-roofing procedure opens up the tunnels and we clean the whole thing out and prevent that sinus or tunnel from regrowing. So I'm gonna get you marked and then they're gonna prep you by getting you numb.
All right.
First, I'm gonna start by identifying the areas that I wanna do the de-roofing procedure. So I'll mark those areas and then I'll numb them. Then once she's numb, I'll take a scalpel, peel off the top of the skin, and then take a curette and kind of dig that skin out. A lot of scar tissue. Then get all that gunk out, and then she'll have a clean wound base. Deep breath. You're done. Yay! You're done.
Good job.
Yes.
You did very, very well.
Excellent, yes. This condition goes far beyond just hair. It's not aesthetic. It is a debilitating, painful condition. So my hope is that we helped Nisha today and that from here she can be the best woman, mother, and wife that she wants to be. Hi, is this your family?
Yes.
Oh my goodness, nice to meet you guys.
I'm walking out of this thing happy. I'm going to be more active and I think it's going to make my relationship better. And I would definitely recommend Dr. Mina.
Nice meeting you.
Nice meeting you too.
Nice meeting you all. Bye.
So it's a superficial, what we call skin surgery. Patients will sometimes say, "Do you get to see my skull?" I'm like, if we see your skull, I'm calling 911.
I'm going a little deep there.
We've started Jamie's surgery, and I'm about to remove a piece of specimen out of the back of the head, and that's where all the hair follicles are located. And because Jamie suffers from male pattern baldness, and she's got kind of a relatively small head, every hair follicle is important, so I have to be so precise that I make sure that my cut is made at the angle that the hair follicle is exiting the skin so that I don't damage or transect the follicle. Because if you transect them, they won't successfully grow. I'm just trying to keep hair alive, people. Now, Jamie, are you a looker?
I am a looker.
You ready? Look at that.
Absolutely crazy.
Isn't that amazing? You see those little tiny black dots?
Those are
That's
the
the
individual
root
follicles.
of the hair follicle that resides in that fat.
It was a pretty awful thing to look at with the hairs sticking out, and the fat layer on the bottom was extremely gross and a little daunting. So with that strip that just got pulled, what's happening with it right now?
So I passed that strip of tissue with the hair follicles in it off to my technicians.
Right.
So they're gonna dissect out each individual hair follicle one by one.
Sounds tedious.
We call it artistically meticulous.
All right.
That sounds better.
For sure.
Yes.
I am so nervous that it isn't gonna be enough follicles to have a full head of hair.
Okay, Jamie, I'm gonna start making the little incisions. I'm now going to make the individual incisions where the follicles are going to be placed. So this is the time to be as precise and meticulous as possible and not just go in there in any haphazard way, because anybody can take a scalpel and make incisions into the scalp. But it's about paying attention to the right angle and direction and orientation that the hairs would have been in their native state.
Sounds like a pencil and paper.
All right, Jamie, we are finished cutting all the grafts. The number that we harvested was 2,860.
That's pretty good.
That's really good.
I didn't get the 3,000 grafts that I was hoping for, so there might be some concessions that we have to make along the way. But it's still a very good, solid number of grafts. However, there is one potential issue that I need to make Jamie aware of.
When I was looking at your donor area underneath the microscope before we took the grafts out, and with my naked eye, the donor area looked really good. But when we cut out the individual hairs, we actually saw how very fine they are. When you separate fine hairs apart, it can lead to not getting a really dense result, okay?
I see.
So when I was evaluating Jamie's donor once it was surgically removed, I'm finding that her procedure is not going to be necessarily surgically challenging, but it's going to be aesthetically challenging because her hairs are very, very fine. So when you separate very fine hairs, it limits the density. And so you need to get those hair follicles as close together as possible to be able to create that aesthetic change. Right there is perfection. All right, it couldn't look any better if I did it myself.
Amazing.
Everything looks perfect. We were able to recreate the natural feminine curved hairline, able to get the entire recession area, the middle, and then leading into the top area where it's blended with the existing hair.
I see.
A very successful surgery in being able to completely address the area that had no existing hair, which is the area of most concern.
Right.
But the top and back that we didn't get to has existing hair in it that we're just going to maintain with medical therapy and try to stimulate with other treatments.
Looking at what she did and what I have now is just unreal. My only big concern now is that I can't wear a wig for 4 days, so I'm gonna be walking through the airport on the way home without one on, and that is incredibly nerve-wracking, but worth it.
So we're gonna get you up and get you changed back into your clothes.
Absolutely.
All right, very good.
When Jamie comes back in 8 to 12 months, I'm anticipating on seeing a large amount of hair growing in that area where she was totally bald. She will no longer be bald. Well, Jamie, you did it.
I did.
You survived. Yeah, we did it. We did it together.
Thank you so much.
It was a pleasure, and if you need me, you call me.
I think that when I look back at this moment in 5 years, this is going to be the turning point of the rest of my life. Like, everything from here is the new and real me, and everything before was a bit of a fallacy. Weirdly enough, this is the best hair day I have ever had.
Right.
I'm so excited for you. So we are at the surgical center this morning because Eric's surgery is about to happen. Eric decided to go ahead with the surgery. And it just so happens that we have a plastic surgeon next door.
You think you can do it safely?
Yes, we should be able to get this out.
All right, well, that sounds good to me. I'm willing to try if you are.
Okay.
Dr. B has a surgical center he can use. He has an anesthesiologist that can monitor Eric's vital signs, and I think Eric will do fine. You do have a mental, just, breathing, calming, whatever you have to do.
Eric?
Yes.
I'm ready for you.
You got this.
Thank you.
High five.
I have a very, very busy day in clinic today, and I wish I could stay, but I can't. My concern is still hairline. So where is his hairline gonna fall? Is Dr. B gonna be able to make it look pretty? I'm pretty sure he is because he's a plastic surgeon, but nonetheless, that issue's still there, that problem is still there. Dr. B is gonna have to figure that part out.
Okay, this is Eric Block. He's having excision of lipomă to the back of his neck.
All right, agreed. Well, I've been looking forward to tackling this one, but there's always a variable. You think you know the case just looking at it, and then you go to open it up and you realize, oh man, this is diving through structures I wasn't prepared to be inside of. So I'm gonna start with my incision and start lifting up the skin. We're just getting through the top layer of skin. So it's just now trying to figure out, is this the fat that should be there, or are we at the lipoma? So this is its shell. This was what we call it, like an encapsulated, like it has a little film over it that is a little natural barrier between the skin and everything else. I'm just getting around it. Once you get it free, you can push it through that stretchy skin, and now it's a relief. Like you can see all around it. I'm not working in a hole anymore. I know I'm safe now that I can see everything that I'm doing. So we're about to the base of it here. So last little bit, just gotta make sure there's no big blood vessels hiding in it. That's it. Very satisfying. I was looking forward to that since the moment I met him, and I'm very happy it came out in a solid piece like that. So now, you know, what I'm gonna do is remove the extra skin, and I think that'll be the best approximation of what I can do to make his hairline even. I think for Eric, he's come to accept this, get used to it. I think he's gonna realize within a short period of time how much he's had to put up with and how much easier his life is going to be in a lot of respects. Just about to tie my stitch down here. And that's it. So the whole surgery went well. It does feel good getting something like this accomplished. I know that we delivered what someone wanted. It's going to make them feel better. In his case, he's going to feel relief and he's going to feel confident, and you know, I don't think there's anything else I'd rather do with my day.
When I see Eric again, I'm probably not gonna recognize him because he's probably gonna cut his hair because he won't need his hair anymore to hide it. And I think he's gonna be just a really confident person. I just can't wait to see what he looks like.